We are here with Dr. Dean Schweitzer from Valencia Headache Care, and we were talking, Doctor, about some of the issues, what we were talking about as far as headaches, and chronic pain, and just masking the symptoms, which does not solve the problem. Kind of like having your check engine light on, correct?
Yes, so pain is not normal, right? Our bodies aren't normally experiencing pain. So when we experience pain, it's telling us we have a problem. So imagine if you're driving in your car and all of a sudden your check engine light comes on. You kind of feel like, oh my God, I got to get that taken care of right away. I mean, what's going to happen if I don't? So you get your car to the mechanic and he says, yeah, you got a problem and, we can fix it, but it's going to take a little bit to fix it. And you're going to say, well, I got to do whatever I got to do because, I got to have my car. But when we have pain in our body, we don't react like that. We just kind of want to, well, it's going to go away, or I can just get rid of it, or whatever. But it's really telling you something to say there's something wrong with you, and you need to investigate as to why you're having the pain, and then fix that instead of just masking it out.
Exactly. We're talking about some of the symptoms too, and interestingly enough, something a lot of people don't realize is an imbalanced dental foundation that could be causing that pain.
And that's because you can't feel it. But our research, medical dental research, shows us that most people with chronic headache pain that where we've ruled out any kind of underlying neurological problem is due to an imbalance in your biting forces, which then creates an imbalance in your muscles and a dysfunction in your muscles, which then creates the pain. So almost all headache pain that's not neurologically based in terms of brain tumor or anything horrible like that, it's due to a dysfunction of the muscular structure of your face becoming from an imbalance in your biting forces.
Exactly. We're talking about headaches and migraine, pain tooth, and I should say tooth pain, grinding, and we talked earlier about vertigo and dizziness and tinnitus as they're related to that type of jaw issue, and even possibly other kind of neurological issues, such as like my friend having a little bit of paralysis there as a result of migraine headaches.
Yeah, absolutely. Some people with migraines get ocular auras where they get blind spots in their eyes, or they can get nauseated and vomit, and it can be very debilitating.
So I want to talk a little bit about taking a trip down to Valencia Headache Care. What is it that you're assessing when someone shows up?
We want to find out if you have an imbalance in your biting forces. So we have amazingly cool technology. It's digital technology. All you do is bite on a sensor for us, and our computer screen shows up every point of contact that you have in your bite and what the forces of that, what the forces are in that particular point, and we know what the balances should be. So we can easily determine instantly whether you have a biting force imbalance.
So you're just biting a little sensor. You're not packing anybody's mouth with clay like the old braces back in the old days. Well, that is good to know. First of all, so at least it's a much less stressful environment.
It's easy and not uncomfortable, and takes about 10 seconds.
That is great. Mm-hmm. From there, we talk about different types of treatments and things like that, which I want to get into in a subsequent interview. But we're talking about going there, the sensor, you find out, if they don't have a imbalance in the bite, is there still something that you could do to treat?
So of all the patients that we've treated, we've never found anybody without an imbalance that has headaches.
Interesting.
Okay. We have taken recordings of people with no headaches, and we usually find a balanced bite. So if you're having chronic headache pain, it's almost always going to be an imbalance in your biting forces.
And this doesn't matter if you grew up and went to the dentist every 6 months of your life, and you have braces and you've done the whole 9 yards, and you have like the most perfect smile. That has absolutely nothing to do with it.
Absolutely. You could have the most perfectly arranged teeth and still have an imbalance. You could have the most unorganized teeth and have perfectly balanced bite. And so most of our imbalances come from some kind of micro or macro trauma. And if you go back in your life and you found that you had head trauma of any kind, when you were a kid, you played soccer, hit that soccer ball, you got into a car accident, fell off your bike, or just sometimes going through orthodontics or having your wisdom teeth out or micro traumas. Any kind of trauma can create this imbalance in your biting force.
So that's fascinating. And talking a little bit also about the assessment there. So we've got the bite force analysis and range of motion analysis. Did we talk about that? No, I don't think we have.
No, we have not yet, but we do a range of motion analysis. That's a range of motion of your musculature because it's all related. And so we want to assess what kind of range of motion you have with all of your neck muscles and your opening and closing jaw muscles.
So in other words, and the way that your jaw is situated could be causing stress that you don't even realize on muscles that you don't even realize you have.
Right. You don't realize what actually is working when you're opening and closing your mouth or turning your head. And all those muscles are related to the imbalances in your bite.
It's kind of like sleeping on your pillow wrong. You don't realize it until you wake up the next morning. And also a muscle exam, just along those assessments, that's another
we do a trigger point exam, because most people with chronic pain and headache don't realize it, but they have trigger points, which means that when we touch certain parts of their face or neck or head, it's painful, and that helps guide us as to where the problem's coming from.
And then also, we talked a little bit about this, but headache history and headache health questionnaire, just finding out obviously when these started. And you mentioned also possible traumas that could have taken place without us even realizing that that's what happened.
We like to get a history on everybody anyway, health history, but then we take that a step further and just do a headache history to see what's gone on in their life.
So did you play football as a kid? Or soccer? Were you in a car accident where you dropped on your head as a baby?
I always ask the question. Mm-hmm.
Exactly. We're talking with Dr. Dean Schweitzer from Valencia Headache Care. It's valenciaheadachecare.com, getting all the information. And also, as far as setting up a time to come out and just get an assessment, number 287-9667, and just call and schedule an appointment?
Absolutely. My staff's amazing, and they'll set up a 15-minute complimentary appointment for you so that you can come and visit us, see what we have, see what we know, what we can do for you, and go from there.
And that was a 15-minute complimentary appointment. It's very, very important. So if you've got a headache and it's not going away, it doesn't hurt to at least stop by and find out. valenciaheadachecare.com.